When is a good time to start seeking a naturopath or alternative care? 3 things every adult should get checked this year. Woo! There's such a keto hype right now. What are the top 3 easiest health-boosting habits that not enough people are doing? Ivy, you have such a calming presence. And living here in New York, how in the world are you able to do that? Hello and welcome to StreetSmarts MBA, the podcast where we teach you how to be an adult. I'm your host Yaffa. My guest is Dr. Ivy Branin, a naturopathic doctor who started out in biochemical engineering, spent 3 years in big pharma, and then made a sharp pivot into holistic medicine after a life-changing retreat in Thailand. These days, she's practicing in New York City, blending science with natural healing and helping people untangle what's really going on in their bodies. Thank you for being here.
Thank you so much, Yaffa, for having me.
So you've had such a wild resume with twists and some pretty sharp turns. So what pulled you out of engineering and into medicine? And what in the world happened in Thailand to help you make such a big shift in your life?
Wow. Okay. So I guess some background. So I kind of fell reluctantly into engineering in the sense that in school I was really good at math and science, and I was a woman, and this is the late 90s, so it's all about pushing women into STEM. And I actually did like chemistry, so it just was the right fit. And I'm a pretty practical person, even though it might not sound that practical that I'm a naturopath. But I knew that if I, specifically with what my guidance counselors were saying, if I go into engineering, I will make good money. And you know what? They were right. Engineering is one of the few degrees where the BS, the Bachelor's in Science, is enough to actually land you a decent salary with great benefits. But I just really did not like the work. I didn't even really like my undergrad experience. I did well. In fact, actually, I was always hoping I might flunk, and then that would cause me not be an engineer, but I always ended up still doing well. And I did get a good job in engineering, but I always knew that I wanted to be doing something else. I had no idea what that was. So I was working for my first company. I was actually working on vaccines, and then I ended up getting an even better job for a smaller biotech that was working on inhalable insulin. So in between working for the vaccine company and the little biotech company, I had a little bit of a break, and I was also super burnt out. I was always interested in healthy things. I was a runner, but I was just not feeling my best. So I was I think I need to go on a colonic fasting retreat. And Thailand actually is a really great place for that. It's fasting and doing enemas, doing yoga, and learning more about natural medicine in general. You're beautiful, blissed out and
hungry,
Thailand. After a while, you really just you just talk to people because you're not eating, so you're just having these interesting conversations, and they have lectures. I think Copenhagen is probably different now than it was back then. It was pretty savage. So the way you got around the island, they had the back of a pickup truck, to get to the part where the retreat was, and then there was these boats, and you're oh my gosh, are we gonna tip over? And then I remember walking along this beach, and no one was a mile ahead of me, and no one was a mile behind me. And there's these interesting starfish, and just it's this is my own private island, and I had to hike there. So just again, it's probably not like that anymore, which is kind of sad. But to experience that, I had never experienced something like that before. But then, to then come back to the cold, harsh winter that we have here in the Northeast, and then immediately plummeted back into a new position at a different company. But it was the same cast of characters. It was the same types of assignments. It was everything I didn't want to be doing, essentially. But anyway, so I ended up, working for this other company, but that was what actually really introduced me to naturopathic medicine. I moved from the New York metro area to Connecticut, and my neighbor was going to a homeopath. I had no idea what a homeopath was. And I got a book from the library and I started doing some reading. When I was in engineering school, I was doing some work study and interning with more the pharmaceutical department because that was actually my bigger interest in the engineering. And there was some overlap a little bit with homeopathy. And I actually found a homeopath out in California who had gone to MIT, had been an electrical engineer. So I was like, wow, if somebody with that background could become a homeopath, maybe that could be me. Well, after talking to her for like about an hour, she said, you're single, you're young. I was 25 at the time. You don't have all this baggage. Rather than going into homeopathy, you should really look into naturopathic medicine. I didn't realize at the time that one of the naturopathic schools was in Connecticut. There's a lot of naturopaths in Connecticut. But the more that I talked to naturopaths and the more it just felt like the right fit. I would say, unlike my decision to be becoming like an engineer, which is a lot more logical. This was a little bit less logical, but there was something about it that really spoke to me. The other thing, when I did become an engineer, I pursued pharmaceuticals because that felt like the kinder aspect rather than working for petrol or something like that. I'm really helping people. But as I was studying in school, I was realizing is this really the best answer? And I have an aunt who has been on multiple pharmaceuticals and now is in a nursing care facility. And I just always wondered, would a different intervention have set her on a different path? I remember also when I was in engineering school, that was when Vioxx became this huge life-saving, amazing drug, and then what do we find out years later? All the ramifications are in cardiovascular health.
Wow.
So just these things alone, just we're planting these seeds. I know some people, they end up pivoting to more the alternative medical fields because of an ailment. Right. Mine was a little bit of a different journey.
You've learned off of other people's mistakes. You
Yes.
didn't have to experience it on yourself. So what is the difference between a naturopathic doctor and a homeopathic? Is there such a thing as a homeopathic doctor?
Yes, actually
okay.
there are.
Mm-hmm.
And that's a question I get a lot. So I have my favorite answer. So I always like to think of naturopathic medicine as an art and that homeopathy is one of our paints. So we have all these different modalities that we can use with a patient, and homeopathy is one of those modalities. It's a little bit controversial to say treatment method just because of the way New York's state is, but in other states you can definitely say treatment. But I would just say the way that we address a patient's issue could be through homeopathy, but it also could be herbal medicine, it could be nutrition, it could be physical medicine. So there's all different aspects. And then even like naturopaths in other states can even use pharmaceuticals as part of their modality system even. So there's a lot of different things versus classic homeopathy, they only use homeopathic remedies.
I'm somewhat familiar with it, but please, if you could tell us more.
So basically there's like a couple principles with homeopathy. And again, like I do sometimes use homeopathy in my practice, but it's not really naturopathic medicine per se. But so one of the big principles is like cures like. So when they were developing homeopathy, they would take these certain substances, something maybe like belladonna or snake, like typical things, strychnine, what's the Madame Bovary, arsenic, these different substances that are typically toxic. They would give them to people, and they would do what's called a proving. So they would basically write up their symptoms, and they put that in the repertory. So when a homeopath is taking a case, they're asking you all these questions about your symptoms, but sometimes it can be like, what are your cravings? What don't you like? When you touch this, what kind of sensation is eliciting? And so based on all these different types of symptoms, they take those into the repertory and finding which remedies elicit that the most, and then by giving that person the same thing but in the most dilute form, that can counteract the whatever it is that the patient has. So that's like cures like, and then also the other kind of guiding principle is the most dilute is the most potent. So working on potencies with the remedies. And then there's different ways of prescribing. So there's acute prescribing. So, you come to the doctor and you have a headache, or you fell, or you have like a sore throat or an earache. And there's for example, like an earache, there's, as I mentioned before, belladonna. There's also different remedies that based on your presentation, which one of those acute remedies. Those typically tend to be less potent. And then there's this idea around what's called a constitutional remedy. I don't do those as often within my practice. But with the constitutional prescribing, you're really asking a lot of questions about that person. You're really kind of determining, who that person is and what their remedy is. And that remedy typically usually would be either like a 200C or a 1M. Also, sometimes some homeopaths might use that constitutional remedy as what they would even use for acute prescribing. Again, with my practice, I do use some homeopathy, but I wouldn't also say I'm the main expert, though a lot of when I was in naturopathic school, we had to do a total of 4 homeopathic classes, and I did a couple of shifts, and I definitely did a little bit extra because that was something I was very passionate about at the time.
That's incredible. Do you work with conventional medical doctors?
Yes, definitely, for many different reasons. I work with both conventional labs and conventional diagnostic techniques in addition to more of an alternative lens, I would say. And so, for example, I can't order somebody a CAT scan or ultrasound or colonoscopy or certain blood tests, et cetera. And so it is actually very important for me to establish really good relationships with medical doctors. Also, a condition that I work a lot with is cervical dysplasia and HPV. And in order for my patient to get a repap or to look at or colposcopy, et cetera, they really do need to be working with a conventional doctor for that type of workup. Also, the other benefit, because specifically if we're thinking about insurance, for example, it's a lot more cost effective for my patients to go through their primary care doctor, general practitioner, or whatever specialist to get laboratory testing. So that's one of the reasons why I maintain relationships with conventional doctors. The other thing is, part of my practice is really helping patients wean off medications. So I work a lot with patients on antidepressants, anxiolytics, blood pressure medications, and just some different medications. Also, I work a lot with patients with thyroid condition. So across the board, I need to make sure, one, that the patient has had that conversation with their doctor that they will be weaning off said medication. We also often have to change the dosages forms. For example, just recently I'm working with this patient to help her wean off Zoloft. She started with me 150 milligrams of the Zoloft. And in order to do a really nice taper, we really needed her to be getting the 25 milligram tablet. So whenever I'm weaning somebody off, specifically antidepressants and anxiolytic, the key to success is as slow as possible. So in order to do that, we really needed her, because we're even cutting those 25s into quarters. So that was something, I couldn't write that script for her. She needed to communicate this with her psychiatrist, and luckily they agreed to that. So often that's another reason why I have to have relationships with conventional doctors. I also do get referrals from conventional doctors. Either they're missing something with their patient, or maybe their patient also is interested in seeking a natural way for their condition, or maybe they've read up on something. The other really important aspect of my education is really understanding drug herb and drug nutrient interaction.
Interesting.
So, specifically, if I could talk about weaning patients off of antidepressants all the time. Because specifically when you're weaning somebody off of antidepressants, there are nutrients that help to support that weaning, but you have to be really careful on when you introduce them, because you have to wait until they get to a certain dosage of their, I'm just going to say SSRI specifically, or SNRI depending, because you do have that potential of serotonin syndrome. So really understanding when it's appropriate to add certain nutrients, which are going to help them feel better, but you can't add them too soon or too high of a dosage because you do have some of these risks.
It's amazing. My question is, why would a conventional medical doctor send their patients to you, to a naturopathic doctor? Or what would need to happen for them to decide, you know what, I'm going to go that route?
Right.
Mm-hmm.
So I think it's a couple of things. So I think I definitely have some patients that come to me from their medical doctor, and I think because they might be that patient that keeps asking the medical doctor questions that they can't answer, like, should I try this herb? Should I take this nutrient? So there's that one thing that they might be. But then also, something that, there's been different trends within my practice, and specifically when long COVID was a real issue, a lot of conventional medical doctors didn't really have a lot of solutions for these people. And so I was also getting a lot, I wouldn't say that's like one of my big specializations, but I was getting a lot of referrals because of that, just that they didn't really have anything to offer these people.
Are naturopathic doctors covered by insurance?
The classic doctor answer of it depends. So I primarily operate out of New York State, which is this sort of interesting area in that, because then this kind of also gets into this issue around license and what's recognized. So, I technically have a license. I'm technically a licensed naturopath. New York State doesn't currently license naturopaths. So there's sort of this kind of unusual kind of like gray zone. So my practice itself is a cash practice. What I can offer for patients is we can give them what's called a super bill. And a lot of people who maybe have gone to a registered dietitian, nutritionist, most mental health counselors, psychotherapists, most of these types of practitioners are all, even acupuncturists, as you mentioned before, all typically cash practices. You can submit to your insurance company. Definitely it only works, one, if you have out-of-network benefits, and also if you have a really good plan with your provider. The other thing that patients can also use is health savings accounts, or also what's called FSAs. And both of those are actually even good towards supplements. And then I do have an associate, and she was even saying there's some alternative stool testing that we do, that one of them actually is covered by, I think she said Medicaid, and I was actually really surprised. So a lot of times it's a question with your insurance company. Now, in other states where naturopaths are licensed, specifically when they have a wider scope of practice, most of those states, insurance covers.
Why would someone who believes in conventional medicine so much would even consider going to a naturopath?
So people come to me for a couple of different reasons. There are those that just are natural people. They just don't do anything conventional. They would never take a pharmaceutical. They might not have even been to a doctor, like a conventional doctor, in 5 or 6 years. So there are these people that are already kind of sold on that is their way of life. And sometimes they're actually very surprised that I actually want them to go to a conventional doctor in addition to my work. So there's those people. Then there's the set of people where they've gotten a scary diagnosis and they're just doing everything. They're doing acupuncture. They're doing chiropractor. They have their conventional specialists, whether it's an endocrinologist, gynecologist, cardiologist. They're doing everything, and I'm there, part of their team. Then there are people that they have been doing the conventional model. They have their specialists. They've been taking the medications. Nothing is working. It hasn't been working. Or it's working, but either the side effects are unbearable, or then, I've had a couple of women come to see me because they were on pharmaceuticals that are contraindicated during pregnancy. They need to come off of them because they want to start a family. They either have to completely come off of, or they have to like reduce to a certain dosage in order to get pregnant. And then I would say then there's also these kind of back to the more mood patients. So there's these patients that are at that crossroads. Maybe they've been in psychotherapy for many, many years, and they're starting to have that conversation with their therapist. Is this time for me to start an SSRI? Is this time for me to go on a benzodiazepine? Or I'm not sleeping, or these kinds of change of life things. So these are some of the kind of like categories of patients without going into condition specifics. I would draw someone. Or sometimes there's also the people that they have a family member who has seen a naturopath and they've noticed the change, and maybe they have either, I do get this a lot where I work a lot with patients with PCOS, polycystic ovarian syndrome, which really runs a lot in families. So I'll get like the cousin, the sister coming in because they've noticed that their sibling, their cousin, their friend has been getting better as a result. So the process is definitely different in the sense that, one, we spend a lot more time with our patients. And I would say, I think sometimes patients also don't know the behind the scenes time that we're spending with them in the sense of the amount of research. So, a typical first appointment is probably going to be about 90 minutes, and then follow-ups, depending on the complexity of the case, can be 45 minutes to an hour, because we do, specifically with the first appointment, we definitely cover a lot. We're looking at both from like a conventional lens and a natural. I can really only speak from how I practice, and some people might go to a naturopath and they might have like a completely different experience. So I'm just going to kind of talk more from what it's like kind of working with me. So when I have that patient in front of me, I want to first find out all the nitty-gritty details of their diagnosis, of why they're in front of me. Just from like a purely conventional lens. Like if I have a patient who has fibroids, how often was she getting ultrasounds? Like what are her symptoms? Is she on birth control? And then like family history around fibroids and even like adjacent, like did somebody have a hysterectomy? Does anyone have endometriosis? Did anyone have fertility problems? And again, and also just knowing what medications they have been on, what are they currently on. So I'm getting kind of like more of like what a standard you would hope would be covered during just a standard medical appointment. I'm also going to be looking at their blood work. And I always find, it's always funny, I will always have a patient saying like, I've had every test done. I will always say, when I go through their labs, I'm like, this is missing. I mean, I definitely see this a lot with specifically when patients have thyroid tested, that there's always like things missing that I would want to see because it does not giving me the full picture, or just like that there's always like gaps within the blood work. And maybe there's also just some other things that we would want to be looking at. So I'm looking at all their diagnostic and blood work. Then we get into what I call like both like associated symptoms and some systems. So it's not just about like, okay, you come to me because you have fibroids, but I'm also going to be wanting to know, how are your different routes of elimination working for you? Like, are you regularly having a bowel movement? Are you sweating? Like, what is your skin like? What is your breathing like? What is your energy? And then other systems that I'm going to be interested in is your sleep. Are you having difficulty sleeping? Are you a night owl? Are you not sleeping well? Are you sleeping too long? And then even then, like, what are some of the factors that are causing you to sleep the way that you sleep? What are your stressors in life? And how are you dealing with the stress? Do you exercise? Or the type of work you do, are you mostly sitting? Or is there like more opportunity for moving? What are your relationships like? what is your home environment? So when I talk about home environment, not just from like the relationship with the people in the home environment, but like what kind of cleaning products are you using? Has there ever been mold damage? So all these things could be factors in someone's health. And then lastly, which is my favorite thing to talk about, is diet. Like, what are you eating? How are you eating? Do you cook? Are you eating out? What are like the materials that you eat out of? When do you eat? Why do you eat? What are foods that you will never eat? Are there any things you're avoiding? Do you follow a specific dietary philosophy? Do you have either currently or in the past an eating disorder? So I'm really asking a lot of questions. After that, that's when I fine tune of what I think is going on and what are the pieces missing that are going to be proving my hypothesis. Like, does this person need some additional testing? Do we have enough testing? Mm-hmm. What are areas in their life and diet that needs to be changed? What are the herbs and nutrients that I need to be giving to this person to support them as we heal their systems?
Yes, these definitely are not the questions a typical doctor would ask. That's remarkable, Ivy, really. One of the things that I've noticed that a lot of times, and we live in those times where people confuse wellness with whatever is trending.
Yeah.
So, and frankly, it's exhausting to keep up. First, kale was great. Now, kale is not that great. Right. Now, I'm seeing the rave with protein bars, which are considered health bars. Do you have anything to say about anything that we see trending right now that might not be necessarily healthy, but people are consuming them like they're okay and they're actually good for you?
Right. So I'd say, first off, I'm like so not hip or cool. And it's always like one of the great things is my patients always tell me what's trending. Because like I'm just like not that into like, I know what works for me and like I'll be curious about different products. But I would say definitely obviously everything has a grain of truth to it, but I'm not a big believer in one size fit all. I'm also not a big believer that something is all bad or all good, and it really everything is about context. I mean, if you take something like a protein bar, okay, probably just subsisting off of protein bars and thinking that that is the best way versus like having actual normal balanced nutrition is probably not going to be a great bet. But, if you're having a really busy day, you're traveling, protein bars can be a good way to fit those gaps like as needed, or having it, if you're somebody who is prone to low blood sugar, or you're just like having one of those crazy days, like having a protein bar in your bag probably is a decent idea. I think everything in moderation, and there is like a time and place for them. I do work a lot with acne, and one of my acne patients who had been doing really, really well, she got overly consumed with her work, and she really put nutrition by the wayside and basically was just subsisting off of the protein bars. And you know what happened? Her digestion got out of whack. She started getting constipation. And then next came breakouts again.
Oh, wow.
So again, I'd say protein bars in moderation, like if you really have like in a pinch, but really overall, I just think just like proper balanced nutrition, minimally processed is the basis.
Ivy, what are your thoughts on intermittent fasting?
So it's very nuanced, and there are some benefits, and technically we're all doing some intermittent fasting at some level because most of us are not eating throughout the night. Ideally, we should be only eating between 8 a.m. and 8 p.m. with the reason being is that when you eat outside those times, you're actually forcing the pancreas to excrete insulin when it wouldn't, and that can be setting yourself up for insulin resistance. Now, outside of that, like the more extreme, whether it's really having the short or basically like skipping days. There can be some short-term benefits as far as like increasing liposis and working with blood sugar, but like the overall long-term gains, I'm not so sure. And then because I work mostly with women, and when we think about like the female reproductive system, specifically in the fertile years, anything that's going to make the body think that it's starving is going to negatively impact reproduction, which is then going to have a negative impact on a woman's cycle, even if she's not trying to get pregnant. So that is going to have an impact on hormones. So having extreme periods of fasting outside of maybe from a religious content, or sometimes fasting has to be done, like maybe you're getting a procedure, etc., may not be that beneficial and actually could be backfiring. I guess in the other context of where fasting or intermittent fasting might be problematic is with thyroid conditions. So we have T4, which is our less active, and T3, which is our more active thyroid hormones. But we have another thyroid hormone, which is reverse T3, which is basically non-active T3 thyroid hormone. And this actually gets produced more during periods of starvation. So someone who's having difficulty losing weight or has difficulty with their thyroid, extreme fasting is probably not going to be that beneficial.
So since we're here already, what are the top 3 easiest health boosting habits that not enough people are doing that you would suggest that we should just get to it?
One of the first things I'm putting on a lot of my patients' treatment plans is increasing vegetables. At a minimum, 4 cups a day of vegetables. That's going to be giving you fiber, vitamins, minerals. It's really important for gut health. And there's so many different vegetables. Like if you, you hate broccoli, try cauliflower or green beans. There's different ways of preparing them, but really just getting in the 4 cups of vegetables, I think is just like a crucial, very basic thing at a bare minimum to do.
Would you say raw, cooked, fried, steamed, is one better than the other?
I would say the best way is the one that you will do.
Oh, okay.
Which
very
is
practical.
Which is actually very much like the way with most of my patients, it's like, let's just start with what you're going to actually do. We can always refine it later. And I'd say also like what agrees with you. I mean, I'm somebody, when it comes to vegetables, raw vegetables are not my friend. There's some raw vegetables I can tolerate, but they just don't really work for my digestion. So I typically only eat cooked vegetables. But maybe somebody else, they really can tolerate them. They enjoy them raw. And I'm also like a big believer in actually enjoying your food. And so sometimes like we have to make a compromise with my patients, and I'll recommend doing like a smoothie and throwing in like a couple handfuls of spinach. That's not my go-to. I would prefer that person to enjoy a salad or some nice roasted broccoli or asparagus or do a stir fry. But if that's where you need to start, that's also perfectly valid. So besides the vegetables, everyone needs to have some form of mindfulness that they have in like some form of mindfulness practice. So some of the classics obviously are yoga and breathing, meditation. And for some people, like that might be overwhelming. I mean, I will often, like when I'm working with patients, I will gear them towards maybe starting out with a breath practice just because it's something a little bit more active. And there's a couple different breathing techniques that I will work patients through, specifically with my anxiety patients. And I always tell them, these practices are always better if you actually familiarize yourself with them. So then if a time of anxiety will arise, you can apply the technique versus like if you haven't really practiced it, it might even do more harm than good. But we really do need to be doing these practices to really help to self-regulate, regulate our nervous system. I mean, I would say probably hands down, stress is the number one cause of most conditions, even more so than what we're eating. And so making sure that we have something in our life that we are doing that is going to be helping to regulate that nervous system. And one way is definitely a mindfulness practice. And basically, these mindfulness practices are also just helping us navigate these times of stress. Or more almost like I see them more as like either a training of the mind or a preventative. And one of the things that often people misunderstand specifically about something like meditation is that it's absence of thoughts. And that's, I mean, there might be some people who will watch this and be like, that's not true. But I would say that it's more about understanding the mind and seeing where we can redirect thought. Now, the other thing that I will often talk about with my patients, because even we think about meditation, this constantly, bringing back our awareness, our attention. Well, another way that we can also practice that is by giving either someone or something our full, undivided attention and practicing that. I do have a meditation practice, but where I really find, I think like the two things that I would say are even like more my mindfulness practice. I dance. I've been taking professional level ballet for many, many years. And I have to be so focused in the moment because I have to be able to see my teacher or hear my teacher say a number of steps and then immediately be able to reproduce that in my body. So if I'm thinking about maybe my patients after the class, or I'm thinking about what my husband and I are going to be doing this weekend, or worrying about like current events, I'm going to be missing that. The other kind of where I'm really fully giving, not all the time, but like I try to at least like do this like more than I can, is with my son. Really watching him, and it's not just because like obviously I want him to be safe, but it's also just like this beautiful unfolding of him like discovering our world. I mean, he's very new to this world. He's only 2 years old, and just the things that he is watching, and just being able to be this observer of watching what he's doing. So the more that we can bring that in, I mean, think about like we're always distracting ourselves with our phones, the internet, etc., but allowing ourselves to really fully be present to what is, to either again like something or someone else is really important.
I was going to say in the beginning of it that Ivy, you have such a calming presence. And living here in New York, how in the world are you able to do that? Have you always been a meditator?
So I would say I've not always been a meditator. Mm-hmm. I was in Seattle studying naturopathic medicine. I had a friend who was a meditator. She wasn't in my school. And I asked her about how I wanted to start a meditation practice. She's like, you should probably take a class. So first of all, naturopathic school, it's a lot of classes, so you really don't have that much time. I only had one free night, and that was Monday night. There happened to be a meditation class that was on a Monday night. So I did that meditation class. It was a Buddhist philosophy meditation class. And like the teacher, he was like, cute and charismatic, Dharma talks and everything like that. So I must have taken that class for like 6 months.
Wow.
But I had not started my own meditation practice until in one of his talks, he talked all about how often we're on our phone, our internet, and that basically why is it that we spend all our time doing all these things and we're not devoting any time to our meditation practice. And then from that moment on, I realized I could do this. And so I think I started, it might have been 5 minutes, maybe it was a little bit less than 5 minutes. There is power in meditating in a group. There's definitely power in meditating by yourself, but there's definitely power in meditating in the group. So definitely took time, and I pretty much have a regular practice. Sometimes life gets in the way. I typically usually devote 20 minutes a day. I also have a meditation partner. We meet once a week. We started working together, I think it was like a month or two after I started dating my husband, and we're pretty dedicated. I mean, we will even typically meet even when one of us is traveling.
Why do you keep being pulled back into it? Like, what attracts you to it? How does it make you feel?
It's definitely not always bliss. It's definitely, I mean, I have had meditation experiences where I did have real kind of bliss, but it's work. I mean, it's kind of like going to the gym. You kind of get more of the long-term benefits of just like how you can like react to life, but the actual act of doing it, as far as like feeling blissed out all the time, that's not my personal experience. Again, I've done different forms and also like working in both group setting, having also my meditation partner. And honestly, it's for me, again, this is only my experience, how I feel on the even like my desire to do it or my feeling during the meditation is irrelevant. I do it because of the long-lasting benefits of how I can relate to life and life's ups and downs. I still have a temper. I still like things bug me. I hate the subway majorly, but overall, it's more about how I can relate and incorporate into my life.